2 standard deviation. Okay? So the definition for the degree of malnutrition, it depends of how you take. You take, for example, the weight for age, or you take the height for age, or you take the height the weight for height. On this, we will have like classification for malnutrition. Either he is standing, يعني he's too short, or he wasting, معناته ضعف البيبي. تمام? So here is to explain that when we have no weight for height in the same age, at that moment he is wasting, and this is reversible. The stenting is when the height is compromised, and this is the type 2, and this one is difficult to reverse, so we should not reach the stenting. And the third one, when it's underweight, when the weight is not good for the height, this is type 1. Now, in the studies, لما بيعملوا دراسات ليقيموا the country if they have malnutrition ولا ما عندهم، بيشوفوا النسبة تبع 3 أشياء هيدي. حسب النسبة بيقولوا إنه هذا البلد فيه نسبة undernutrition كثيرة ولا قليلة. It depends on the standing, on the underweight. So for this reason, worldwide, what do you think? أين أكثر؟ malnutrition with underweight ولا malnutrition with obesity? This is the color. The blue is the malnutrition. The green is the obesity. And each region, مثلا South Asia, they have more malnourished than they have problem with obesity. In our region, Middle East and North Africa, we have more obesity than malnourished. And we have this problem like 6 billion. Is it enough? Worldwide, we have 148 million children who are already stunted. These are prone for problem later on. We have 45 million who are wasted, and the growth filtering will predict very poor outcome, metabolic and neurological. So for this reason, the WHO has made 4 of her targets for the program on 2025 is to decrease the wasting and the stunting worldwide by doing many measures. In Saudi Arabia, what is the situation? We have also the first study which is done by Dr. Muzan in 2010. It gives this percentage. Look here, the prevalence of moderate and severe underweight is 6.9 and 1.3. Severe underweight 1.3. بعدين بيجي moderate to severe wasting 9.8 and 2.9. Then the stunting is, the severe one is 2.8 and 10. يعني تقريبا بال10%. هذه الدراسة بال2010. هل اجت دراسات بعدها؟ الجواب هون. اجى ريفيو وذكر نفس الدراسة، ما عملش دراسة جديدة، ولكن اجت دراسة بال2023. It was made on 664. The number is less than the first one, but guess what? Do we have more undernourished ولا أقل ولا أكثر؟ We have more undernourished. It doubled almost. Now we are in the percentage of 20 to 25%, which means that we are not doing anything right. لأنه الناس عم تزيد بالobesity وعم تزيد بالundernourished وصاروا normal هن القلال. تمام. So again, in the organic cause, I don't want to go with it because every pediatrician knows this: malabsorption, problem of increased utilization, the causes of growth filtering. But I will give some growth chart to see together if we can know approximately what is the diagnosis. For example, here, what you see, it's a growth chart of a child, boy, and if you see, you look at the height, the weight, and the head circumference. What you see here, since birth, this baby was below the third percentile.
IUGR syndrome.
Height, weight, and so most probably this baby
IUGR.
is having problem of growth, صح؟ يعني هو من الأصل جاي صغير ومش عم يكبر. And most probably this can be either syndromic or severe IUGR not catching up. So we can just guess, يعني مش ضروري يكون صح 100% ولكن growth chart is very important to have this habit to do the link between the 3 parameters: head circumference, height, and weight. This curve, what you see here, أول شيء بنروح بنشوفه هو الهيد circumference. Head circumference was normal and stays normal, right? Then you see the birth weight was good, right?
Height.
Then at the age of 14, 15 months, he start to
Stunt.
drop. What is this?
This is endocrine cause.
Bravo, growth hormone deficiency, endocrine cause. Excellent. The third one here is very clear. Again, we go to the brain first. The brain, since the beginning, is not normal. It's very small. So the child did not grow. He was good at birth, but did not grow. Why? This is a neurological cerebral palsy.
Corona.
And the last one, which the most important for us, is this one. Here, see, the head circumference is normal, right? Then the weight, the height is normal, but the weight drops in few months. عنده شهرين ثلاثة كان عنده الويت سقط تماما. شو هي الحالة؟
Celiac.
Chronic diarrhea. Celiac or other, right? So this is the third case. So growth chart can be of very good beneficial for us in practicing good medicine in our business. What is this?
بريتير فهمته.
Femton. طيب ممتاز. This is the preterm growth chart. This femton, it was named like this. Why? إذا قلتها
ليش وايد؟
femton يعني شو؟ دراسة
premature babies.
هو يبدو هو بريماتشور هو فهمت نفسه.
صحيح هو growth chart.
أي نعم صدق.
Preterm they don't grow like normal babies up to 50 weeks. ما قبل الولادة up to 50 weeks. But this phantom is named on the name of the doctor who is very recently, she published this on 2016, and she is a dietitian epidemiologist who made this curve, and they give for her many prizes for this curve because now the preterm they have a chart recently tracking their growth in such precision.
هو كان بريماتيور.
Now we will come to the treatment. طبعا if we know the cause, we will treat the cause أول شيء. If we have celiac, growth hormone deficiency, then we have to give nutritional catch-up, oral nutrition. Why? Because we need to catch up and be careful. We have to catch up very quickly. So we have rules like we need to give 200 kilocalories per kg per day. From them, only 3 to 4 grams of protein. This is only small detail because we don't do TPN. Majority we are working in normal clinic. For those who are in critical area, they know about what they have to monitor the progress of the baby. Now we come to the second part of our lecture, which will talk about the non-organic failure to thrive. So we have seen that the organic has a reason, either malabsorption, extra-utilization, or already there is problem of chromosomal or hormonal. The picky eater, which is my favorite topic. So I have a baby who is picky eater, and for this reason, like 13 years ago, I met Irene Chateau, who is one pillar of the study done on picky eater, and she made this book on disorder, feeding disorder, and since that time I'm interested in this topic. We published our first paper in 2015 describing the problem in the Middle East area. Not only we have a group from Dubai, from Qatar, not only from Saudi Arabia, from Egypt. Then later I made this paper in 2024 where I did a study using the BMI, the BMI in in-body machine, which will analyze the composition of a child, whoever he is picky or not picky. And the most important in this published study, here is Wissam, for those who are working in Habib, they know her very well, doing this analysis for the child. And look, he used the CDC chart, this chart, and WHO chart to classify the undernourished, but not only that, to give their body composition. And what is important now, I want to say in this lecture, is the percentage of picky eater in my sample. I have 2,234 baby. Between them, 75% are labeled as picky. When we ask the mother, do you have problem feeding your baby? She answered yes. It was like this, the screen. So now later we ask the second question, was he selective using some food or going right into group. Of course, I have many data for the picky eater, but the most important in this study was this notion. The notion of that we have very high percentage of picky eater in our population, and these picky eater, they can have problem with their weight, they are underweight, they can be obese, and the most important, they don't have enough muscle bulk. And the muscle bulk is very important, it's an indicator of good health. So you can see a child who looks totally normal. On the weight scale, he has a good weight, but when you do the composition for his body, you found that he is full of fat and there is no muscle. And this is the worst scenario, because this child, in few years, he will become an obese, because there is no muscle and the fat keep on increasing with his habit. So, what physician think about picky eater? Do you think it's a problem or no? So usually when I do this lecture, most of the doctor they are telling يعني مش هالموضوع المهم وليش بتحكوا فيه وشو يعني picky eater. But the problem is that this is one of the most important complaints in our clinic, and we need to know really who is sick, so to take out the organic from them, then to classify who is more in need of our help, because sometimes this behavior, if it will stay forever, it's a problem. So, do you think it's a serious issue? Who think it's serious in this house?
Yes.
1, 2, 3,
Oh.
4. Yeah, like 25%. Tamam, we will see. So you will screen for it, you will ask the patient, your baby has difficulty, and you will prioritize this or you will prioritize the disease. So usually, the other question that comes is picky eater somebody who is born picky eater, or are we making the picky eater? Are we, by our attitude, making the children more picky? So the first, are we born as picky eater? We have many data in the literature that show the genetic composition of these kids. And there is many family where the mother will tell you, the father was like this, I was like this when I was young. So it ran in the family. في قاعدة يعني جينية للموضوع. The studies on twins are very important because they show very well that when we have one twin picky, the other one will be also picky. So most probably there is something genetic. How we can make picky eater? It's by the attitude of the parents. The protective parents, those who want to feed their baby, those who are all the time making like gavage to the baby, they create a picky eater. And yesterday in Ispigan, they posted one poster about picky eater, telling that the baby who is spoon fed after the age of 2 years is more risky to be picky than the one who is taking the food by himself. Okay? So the lifestyle also is a problem, because if we offer to the child Pepsi, hamburger, sweets, fast food, how he will not become picky? He will be more selective for food that we have problem with it. The second thing is the screen time. Our children are spending too much time on screen. This is really a disaster for this next generation, and it will increase the percentage of picky eater. And not moving, there is no physical activity. So usually the picky eater is this baby who is refusing to eat, either to finish his meal, he will do mouthing, keep the food in his mouth for a while. The mother will tell you he will take 15 minutes to swallow. This is a problem. Or he will be very afraid of touching or using any new food, or he will be very active all the time, running, and you cannot feed him. So for this reason, the complaint is there. The parents will bring you the complaint. But is there any definition for picky eater? هل في تعريف واحد? The answer, it's not one definition. It's many definitions. We have many definitions for picky eater. So it's a spectrum, more than one disease. So it's an umbrella that can compromise from the one who is refusing to finish his meal to the one who is not eating anything per day, mainly the autistic. And it has also, this definition should be tied to the time. يعني قديش هو صار له بهالعاده هي؟ صار له شهر او سنه او 10 سنين، بيفرق صح؟ The consequence, how much the weight and the height and the head circumference are impacted, and there is impaction ولا لا? And for this reason we need a consensus, and this is what we did for the last 3 years. Now we have many definitions: reduction in variety, reduction in quantity, the small average of light food، يعني بيقول لك عنده عدد معين من الاكلان ما في اكله اكثر من هيك. The slow feed, he take 20 minutes, 30 minutes to finish his meal. He refuse any new food and he avoid the meal time. يعني وقت الميل بيكون في معركة. We can define this in